You're watching KCAL 9 News at 2.
For women who consider their breasts too large and suffer from back pain as a result, breast reduction surgery is their only option. More and more women are getting the surgery, more than 97,000 a year in fact. But doctors say patients should know the pros and cons of this procedure. Countless women long for bigger, fuller breasts, but there's another segment of the female population that's yearning for the exact opposite, smaller breasts. In fact, breast reduction surgery is one of the fastest growing surgeries in the United States. It's grown by a whopping 146% in the last 15 years.
Functional, you are taking care of a woman who is having horrible symptoms of back pain, neck strain, grooving along her shoulder blades, rashes under the breast, unable to wear normal clothing.
Dr. Stuart Lindner is a board-certified plastic surgeon in Beverly Hills. He says women must weigh the pros and cons carefully and understand it's a major operation.
Recovery time for breast reduction is about 6 to 8 weeks. Really have to let the swelling go down and let the breast soften again.
But he says as a plastic surgeon, it's one of the most rewarding procedures because patients are so happy afterwards.
We've done studies and surveys with the American Board of Plastic Surgery and have found breast reduction surgery was the most satisfying operation of any surgery we perform in the United States.
Dr. Lindner says there's something else to consider about this surgery, and that is scarring.
It's a truly significant amount of scarring. But again, it's like an anchor. But it's extremely important to do the correct surgery in order to remove all that extra tissue.
And it may be even more of a concern for women of color.
Scarring can never be 100% predictable. The plastic surgeon can do beautiful suturing and still end up with a lousy looking scar. It's unpredictable. And certainly women of color may develop keloiding, hypertrophic scarring, darkness to the incisions.
But overall, Dr. Lindner says the benefits typically outweigh the risks. The time of surgery can vary greatly depending on how much breast tissue is being removed. But again, those are just some of the pros and cons to consider.